So we know COVID-19 affects a lot of organs in your body. One of the most frequently impacted the kidneys. KFDM's Victoria White reports on the dangers for those with pre-existing kidney conditions and published reports that say the virus can even cause lasting damage to healthy kidneys.
Filtering blood, getting rid of waste, maintaining balance, red blood cells, and blood pressure. These are some of the functions of the kidneys, and in patients that contract COVID-19, this vital organ is especially at risk.
It is one of the organs that is most frequently affected after the respiratory system.
Dr. Syed Raymond at Southeast Texas Nephrology says it's not exactly known how the virus attacks healthy kidneys, but once the infection sets in,
there are other mechanisms come into play, like a drop in blood pressure, respiratory failure that also affect the kidneys.
And the research is growing. Published reports say COVID-19 can damage the kidneys to the point of needing dialysis and could significantly increase rates of chronic kidney disease, an ailment the CDC lists as one of the most dangerous pre-existing conditions when combined with COVID-19.
If they're exposed to and contract the COVID-19, the risk of complications is much higher. The reason for that is they're already very immunocompromised.
Dr. Raymond says this decreased immunity predisposes people to severe illness and in some cases, death.
Patients who do have severe COVID infection and also develop renal failure have a much higher mortality.
He says it's important for people with kidney disease of any kind to protect themselves during the pandemic.
They must take all the precautions, and the precautions are universal.
In Port Arthur, Victoria White, KFDM 6 News.